For many people, nothing brings more joy than the birth of a baby. Many regard the cries of a newborn as the best melodies ever. Unfortunately, a number of pregnancies or deliveries do not bring the desired joy. Complications could arise during pregnancy, labor, or delivery, leading to maternal and child morbidity and mortality. It is also a sad reality that many children do not live to see their 5th birthdays.
In Nigeria, the maternal and neonatal mortality are unacceptably high. The maternal mortality rate is 576 per 1,000 live births, while the neonatal mortality rate is being put at 37 per 1,000 live births.
The good news is that the major causes of maternal, newborn, and child mortality in Nigeria are preventable. Over the years, successive Nigerian governments working with various partners and stakeholders have tried to address the high rates of maternal, newborn, and child mortality in Nigeria. The United States Agency for International Development, USAID, the development arm of the U.S. government and a key partner of the government of Nigeria, has been playing a crucial role in this regard. In 2014, USAID launched the Maternal and Child Survival Program, MCSP.
USAID, in trying to answer the call to global action, there were some different documents that came out, ending preventable maternal death, ending preventable newborn death, and stillbirth death. So USAID, in trying to answer this question, came up with this project to say that they want to try and reduce global burden of maternal and newborn in countries that are most hit.
The ultimate goal of MCSP is to end preventable child and maternal deaths within a generation. In Nigeria, MCSP was implemented in 2 states, Ebonyi and Kogi, with the aim of improving maternal, newborn, and child health at the facility and community levels. The program also aimed to improve information systems to monitor and evaluate health outcomes and to increase use of life-saving innovations. Why Ebonyi and Kogi states?
Because they realized that hospital delivery, hospital attendants in those 2 states were higher than national average. And yet the newborn death and maternal death were almost the same as where in the region where people are not coming to the facility. So they felt that there could be an issue of quality of services that are being received in those facilities.
In Ebonyi State, actually, our own rate is lower than the national average, but by and large, it is exceedingly high and unacceptable. And that is the intervention that the USAID did through the Maternal and Child Survival Program.
Nigeria has featured prominently as one of the highest contributors to maternal and child deaths across the globe. And to us, even though we have made some significant improvements, this is still not acceptable to us.
When we looked at the maternal mortality ratios and neonatal mortality ratios, and we looked at the health-seeking behavior of Nigerians in different parts of the country, in the 6 geopolitical zones, we found that even though there are differences in the coverage for antenatal care attendance and for institutional deliveries, the newborn mortality and perinatal mortality were about the same. And that was a pointer to the fact that the quality of services being provided in health facilities needed to be improved.
To address the high rates of maternal and child mortality in Ebonyi and Kogi states, MCSP implemented a number of interventions covering adolescence and pre-pregnancy, pregnancy, delivery and birth, postnatal period, infancy and childhood.
Are you Ogochukwunede Grace Ada?
Yes.
I want to check your BP. It's not painful.
The period of pregnancy is a delicate period, but could be a wonderful experience if managed with appropriate care. MCSP worked directly with 321 health facilities across Ebonyi and Kogi states to improve the provision of quality antenatal care (ANC). Healthcare workers in these facilities were trained by the program to advise pregnant women to begin early ANC and visit the health center at least 8 times during the pregnancy to check the health and progress of their pregnancy. Not all pregnancies are planned. Therefore, MCSP worked with its supported facilities to introduce family planning counseling during ANC.
Family planning is all about spacing your children and also planning your pregnancy so that you'll be pregnant when you want to be pregnant and have your baby whenever and wherever you wish to have your baby.
MCSP also supported a few facilities to expand ANC services to cover adolescents and first-time mothers (FTM) with little experience in reproductive and sexual health. Through its Hello Mama project, MCSP worked with relevant stakeholders including the Ministry of Health and telecommunication companies to deliver vital health information to pregnant women through mobile messaging. Over 61,000 pregnant women and their caregivers were enrolled and received messages between 2016 and 2018.
These text messages, they are just like a companion to me. We've just been together through the pregnancy period. So like now I'm at the tail end of the distance. The last message I got was just about labor, the signs of labor. When I see fluid mixed with blood, contraction, and then breakage of water, I should just rush to the hospital. That labor has started. I used to have heartburn, so maybe I will start feeling, is it not village people that are doing this thing? So, but immediately they will just send the text message, just take a glass of milk and the thing will subside.
As much as we can, we will sustain Hello Mama program because it's a very good program.
I follow her because she's my project. The pregnancy itself is a project. So I had to suspend every other thing to give it all the attention that it deserves.
More men are getting involved in seeking quality care for their partners and children, especially in family planning discussions, antenatal care, labor and delivery, and bringing their children for immunization. The number of women accompanied by their male partners to MCSP-supported facilities increased from about 1,500 in June 2017 to 4,600 in December 2017 and to 5,600 in September of 2018. This progress was achieved through MCSP's support in orientating and mentoring healthcare workers on gender awareness, provision of privacy curtains in labor and delivery ward. MCSP introduced the Emergency Transport Scheme (ETS) in Ebonyi and Kogi states to prevent delays that could lead to maternal and child morbidity and mortality.
For humanity's sake, somebody cannot be laboring in a house near my house and I'll be sleeping. And most labors came at night, so when they need vehicle. And me as a professional driver, I have my vehicle parked by my house 24 hours. So I just feel like sharing the woman's pain and helping them. Some people at times, they pay fuel money, some cannot afford it. No problem, but at least we just believe in reward, humanitarian services, that's all.
The volunteer drivers enrolled in the scheme transported 539 pregnant women and 315 children with emergency medical conditions to health facilities for treatment between 2017 and 2018, thereby preventing maternal and child morbidity and mortality in the states. To make healthcare more affordable and accessible for women in Ebonyi and Kogi states, MCSP also introduced the Mothers Savings and Loans Club, which have empowered thousands of women members and addressed their health needs, especially during emergencies. About 73 clubs were established in both states with support from MCSP, and over 3.2 million naira, about $9,000 raised by mostly rural and peasant women.
Baby's coming. Because it's low.
MCSP envisions a happy outcome for Nigerian healthcare providers and their clients when every woman who comes alive to a health facility leaves alive with a healthy baby.
Before the inception of MCSP, we actually, the confidence the workers have now, we didn't have. From the capacity building programs organized by MCSP, almost every midwife in this facility is confident to carry out their job.
MCSP has empowered me in my skills, in my knowledge. They've given me so much confidence in myself.
When it comes to conducting delivery, we don't set our equipments. You see somebody running from, baby is coming, you're running for forceps and the rest of it. But now we have been taught that before even the woman is set, a woman in labor, you should ensure that all the instruments you need to conduct the deliveries are on ground.
So I was fortunate, I was among the people that were trained, and I saw things differently, and then it changed everything I was doing. It turned everything around. I came back, I came with another perception. I said, this is not how we do it this way, and we got a lot of results.
And everyone is aware of the timing that oxytocin is supposed to be given within 1 minute of the birth of the baby. That was not the case. Before we used to give oxytocin, immediately the anterior shoulder is delivered.
So they have given me so much courage and given me a hope as a nurse that I can go beyond the things I know and know more, and then do things that I thought I wouldn't be able to do.
Apart from the fact that after each training we do step down, MCSP also gave us models that even if anybody comes in now, I can still retrain that person.
They've taught me a whole lot. Taught me how to do vacuum extraction, taught me how to do manual removal of placenta, taught me how to manage PPH, that's postpartum hemorrhage. They taught me how to resuscitate baby, keep mother and baby alive. Now, when a baby comes out, I will just suction the baby, make sure the airway is clear, give my bag and mask quietly, and the baby breathes and cries. It's so simple and easy.
We have Mama Natali, we have New Natali, we have models that can easily train the new workers with.
I even go about training other people. I'm so grateful that MCSP came in my generation.
I wish there would be an M&E exercise even after MCSP has gone. Come back and see. You will still see that MCSP has left its footprint on the sand of time.
The training has been of tremendous impact, especially for the fact that we know that nobody can offer what you don't have. So the training, I must emphasize, the training has really helped us a lot. We now have health workers in how to reach communities at the rural areas who are able to carry out certain emergency interventions without waiting for the consultants. This I must thank the MCSP for these achievements.
A lot of capacity building were designed, such as basic emergency obstetric and newborn care, the essential newborn care, then comprehensive obstetric and emergency obstetric and newborn care for doctors. So these were specifically addressing those gaps in the care of women around the period of delivery.
More than 40% of maternal and newborn deaths and stillbirths occur in the first 24 hours after birth, according to Lancet series. All women and newborns therefore can benefit from universally available and accessible skilled care during birth and in the critical 24 hours after delivery, including emergency care in cases that develop complications.
So when you have a newborn baby who is sick, what do? Previously, in most of our secondary facilities, they were not having sick newborn corner. But through this training, they have been taught on how to manage a sick newborn baby, and the program also supported them to have basic equipment. Kangaroo mother care, okay, is a special care that provides nutrition and thermal care for small baby too.
The BCPAP machine is actually a revolution, as it were, in this hospital, because we have had instances where we have new needs, especially preterms, that will either to have died.
There was a mother that we're trying to place on it, and we explained the duration for it. And she said she wouldn't want her baby to stay that long on it. So we had a woman who was only for 8 days. So I placed a call to her to help us do the counseling to this mother on the reason why the baby has to stay on CPAP, irrespective of the duration of stay. So the phone was on the speaker, and the woman told her, please, if they ask you to stay for 10 days or 20 days, stay there. My child is over a year old, because I listened to them.
Following the training, we have also tried to improve the counseling skill, you understand, and establish a good counseling technique for most of our health workers, particularly in the antenatal clinic and the labor room, including the labor room. So in this our environment, one of the problems that women have is that they deliver too many. They deliver too frequent, you understand, and it's causing a lot of problems for our pregnant women. It's not as if we are not practicing family planning before, but there are a lot of missed opportunities. We now felt that we should use every opportunity we have in contact with our women to be able to provide family planning services for them, and that is why labor ward is not left out.
My name is Igwe Suzanne. I'm a CHU working at this Izangbo maternity. I had a lot of training by MCSP, and one of it is this IMCI. IMCI has done a great thing in our lives. Unlike before, we used to treat children with diarrhea with flagyl syrup, which don't even help the situation. It at times makes it worse. But now, after having IMCI training, we learn to be using low osmolar with zinc to treat diarrhea children. And they normally get well by using low osmolar and zinc. And those women goes back to the village to announce to others that if your children is sick, bring them to the health center. They usually get well quickly. The nurses there have known how to take care of diarrhea children.
We are proud of MCSP because we never knew that this opportunity will ever come to our way. Formerly, when a child is having diarrhea, we mix. But today, we are proud that if a child is brought to us with diarrhea, we assess the child. We asked how many days that how many times that the child passes stools per day. Then we now ask whether there is blood in the stool to determine whether there is danger sign, so that we will refer the child.
After their training, we start handling pneumonia, malaria, and diarrhea. Doing RDT because of our friends police, because they harassed us before. But after their training, I conduct my RDT. Even if in my shop, anywhere I see a sick child, I conduct RDT without the fear of anybody.
Honestly, I'm even surprised the amount of impact we've had. We've had tremendous impact. When we started October 2016, gradually with those 40 facilities. You can see that there has been massive improvement. Example is clohexidine. I think it was roughly about probably 5% when we started, but now it's almost like 99%, people using clohexidine. Patograph was a difficult one. I think it was around about probably 20 or 40%, and now it's way up to 88%. And then using the oxytocin, the same thing. You look at all the newborn corners we've set in facilities, so everything is there when the baby is born. You're not now looking for a bag and mask if the baby is not breathing. You look at things like the drug revolving scheme, where we have actually supported Ebonyi State to set that up. But even little things like you don't have these things in your facility, but the OIC actually goes out with his healthcare workers to buy those drugs and then actually sell them at a very reasonable rate to the client. You look at respectful maternity care, things like privacy in the facility, talking to the patient, the communication you have with the patient when they come in. I mean, it's just changed significantly since we started. So number of women who actually die as a result of complication during pregnancy, it has drastically come down from where it was in 2016. And this is the ultimate outcome.
The most important thing about this program is sustainability. And we are lucky that we have Kogi State Strategic Health Development Plan, where we have actually looked into the magnitude of our problem and the financial requirements and how our sustainability plan could be attained.
The state strategic plan has been developed in line with the national health policy, and then when we were developing these programs, the MCSP team also participated technically. And then with the interventions we have and with the programs in the Ministry of Health, vis-a-vis the budgeting and the releases, the commitment of the program officers, and the capacity building that has happened across board, the activities will continue.
Right now, we've been able to put the MPDSR committee in place at the state level. We've been able to have discussions with our medical records officers in the 59 secondary healthcare facilities in the state to see how they can record maternal and child death. And the e-platform is so interesting that once there's a death in any facility, an alert is sent to the Honorable Commissioner of Health.
95% of the causes of these mortalities were preventable through low-cost solutions. And this is why the MCSP program came in to highlight this in interventions and to demonstrate in 2 states on how this can be done.
MCSP is unique. MCSP is unique. MCSP is unique. It's been wonderful working with each and every one of them in the course of implementing the MCSP program in Nigeria. So I want to use this opportunity to appreciate them once again, starting from Professor Dipo Otolori, also with Dr. Adetiloye that took up the mandate from him.
What a project, you know, so it's such a huge project, and for us being able to achieve this much, we look forward to having an opportunity to work with the professional association in country, the Society of Gynecology and Obstetrics of Nigeria, which is our partner at global level, so we work with them. So we work with the Pediatric Association of Nigeria, Nigerian Society of Neonatal Medicine, National Association of Nigerian Nurses and Midwives. From the driver, from the attendants, from all the trainers we use that are not even core MCSP staff. Some of them, they are volunteers. Some of them, they get paid. There are a lot of schemes, voluntary obstetric scheme, voluntary pediatric scheme. These are pediatricians, these are obstetricians that go to remote facilities without being paid to provide services on voluntary basis, you know, and some interns that came on board to also assist us. So this goes to everybody, all the staff that dedicated their time to work on this project.